What role does histamine play in pollen asthma? Imagine your immune system as a vigilant guard, always on the lookout for troublemakers like pollen. When pollen sneaks into your airways, your body reacts quickly. It recognizes pollen as a threat and releases a chemical called histamine from special cells in your lungs and airways. This releases is part of your immune response. Histamine acts like a messenger, telling your body to react to the pollen invasion. When histamine binds to specific receptors in your airway cells, it causes immediate changes. The H1 receptors, for example, make the muscles around your airways tighten up. This muscle tightening narrows your breathing passages, making it harder to breathe. At the same time, histamine signals your glands to produce more mucus. This extra mucus adds to the blockage, leading to that stuffy, congested feeling. Histamine also makes blood vessels in your respiratory tract more permeable. This means fluids can leak into surrounding tissues, causing swelling and inflammation. This swelling further narrows your airways and worsens symptoms like wheezing, chest tightness, and shortness of breath. These are common signs of pollen-induced asthma. But histamine's role doesn't stop there. It also influences your immune system by activating certain white blood cells called T helper lymphocytes. These cells produce chemicals that keep the inflammation going. This ongoing inflammation makes your airways more sensitive over time, so even small amounts of pollen can trigger symptoms. Some people are more prone to releasing higher amounts of histamine because of their genetics. Variations in genes that control histamine receptors or how your body breaks down histamine can make you more reactive. That's why some people have more severe pollen allergy symptoms and asthma attacks. Managing pollen asthma often involves medications called antihistamines. These drugs block the receptors that histamine binds to, preventing many of the symptoms. H1 antihistamines are especially good at reducing airway narrowing and mucus production. However, they might not fully control asthma symptoms, so doctors often recommend additional treatments like inhaled corticosteroids. These help reduce overall inflammation in your airways. During times when pollen levels are high, your mast cells become more sensitive and releases more histamine. That's why symptoms tend to worsen on days with high pollen counts. Taking preventive medicines before pollen peaks can help you stay comfortable and keep your asthma under control. Understanding how histamine works helps you make better choices to manage your pollen allergy and asthma effectively.